Hello everyone, this is the presentation of an accepted paper for the IEEE International Conference on Robotics and Mechatronics held in December 2023 in Tehran, Iran. The title of our article is Preliminary Guidelines for Electrode Positioning in Non-Invasive Deep Brain Stimulation via Temporally Interfering Electric Fields, and I am Mobina Zibandepur, a master's student of Mechatronics Engineering at KN2C University of Technology. First, I would like to introduce our laboratory. KN2C Biomechatronics Laboratory was established in 2016 under the management of Professor Dr. Mehdi Derobai. The focus of our research group in the past years was on wearable technologies. One of our recent studies focused on a non-invasive brain stimulation method, which I will discuss further. You can visit our laboratory website through the links below. Brain stimulation has a long history. Early TCS machines were widely available for home and private use, and most people had these machines in their home. The purpose of this device was to improve mental performance, but that was uncontrolled and have caused side effects, including headaches or dizziness. There are generally two types of brain stimulation: invasive and non-invasive. DBS is a kind of invasive stimulation. TMS, TDCS, TACS, and TTIS are non-invasive methods. The DBS method. In this method, two electrodes are placed in the brain with surgical operation. These electrodes are connected to a pulse generator by wires. This device is placed on the patient's body and sends alternate pulses to electrodes, which can treat some disease temporally. Transcranial magnetic stimulation, or TMS, is a non-invasive treatment that uses magnetic fields to stimulate neurons in the brain. It targets specific brain regions, and the accuracy of coil positioning in the TMS is crucial for targeting the desired brain region. Transcranial direct current stimulation, or TDCS, is a non-invasive brain stimulation technique that delivers a direct low electric current to specific brain areas through electrodes placed on the scalp. Transcranial alternating current stimulation, or TACS, is a non-invasive method for brain stimulation. The electrodes are placed on specific parts of a scalp. Alternating currents pass through head tissues, creating an electric field in the brain to specific areas. Now, I want to speak about temporal interference brain stimulation. As you can see in this animation, two electric fields created by two pairs of electrodes are applied to brain with different but close frequencies. Two similar currents, 2 mA, with frequencies F1 2000 Hz and F2 2010 Hz, where these differences, this 10 Hz, is the envelope frequency. These two electric fields interfere with each other and amplify the stimulation in a specific brain depth. To simulate this method, we choose a simple sphere. We place two pairs of electrodes on the surface of a sphere and manufactured the electric fields using Maxwell and quasi-static equations. And to check the stimulation area, we cut the sphere from the XY plane. To check the sphere's stimulation depth, we cut it from XZ plane. We divided the XY plane into 9 areas to check the stimulation area, and we split the XZ plane into 4 parts to check the stimulation depth. We analyzed 3 scenarios, which I will discuss below. First, I must say that I will discuss all scenarios in spherical coordination. In all scenarios, theta is the angle between the electrodes of a pair and phi is the angle between pairs of electrodes. First scenario. In this scenario, the radius and theta are fixed and unchanged. Theta is constant, so the angle of the electrodes of each pair is constant. The current ratio of the left and right electrode pairs are equal 1. In the animation, you can see what will happen in this scenario. The result of this scenario can be shown in these pictures too. By increasing phi from 0 to 135, the stimulation area becomes more limited and the stimulation deepens. Second scenario. In this scenario, the location of the electrodes is completely fixed. We tried to change the current ratio, I mean left to right electrode pair current. As the animation shows, the stimulation region moves from left to right by increasing this ratio. The pattern goes from the left corner to the center by increasing this ratio from 0 to 1. The stimulation pattern is fixed on the center when the ratio equals 1. When the ratio increases by more than 1, the stimulation pattern goes from the center to the right corner. Now I want to discuss more about third scenario here. The angle between the electrodes of a pair is changeable. It means theta is variable and phi is constant in this scenario. The current ratio of the left and right electrode pair equals 1. The result is by increasing the angle between the electrodes of a pair from 0 to 90, the focus of the stimulation region goes from the center to up and down sides, and it doesn't affect the depth of the stimulation. We organized a guideline for stimulation region. We divided XY plane into 3 approximate regions: R11 to R13, R21 to R23, and R31 to R33. The electrode position for this approximate region is the same, but if you want to find the exact region, you must pay attention to the current ratio. If the ratio is between 0 and 1, the stimulation pattern is in the R11 region, I mean left corner. If the ratio is equal to 1, the stimulation region is in the center, R12 I mean. And if the ratio is more than 1, the stimulation goes to right side, R13. This law is for all 3 rows, as you can see here. Another guideline was organized for the stimulation depth pattern. To stimulate D1, phi must be within the range of 0 to 45 degrees. A stimulation of the D2, phi of electrodes must be between 45 degrees to 90 degrees. For the target deep part of the brain, I mean D3, phi must be between 90 degrees and 135 degrees. To stimulate D4, phi must be between 135 to 180, but this is an off-limit area due to limitation in electrode placement in the lower part of the skull. Thanks for your attention. You can find our article on Google Scholar. If you have any questions, you can ask us at these email addresses. I hope you have a nice day. Goodbye.